Welcome to Alternate Care Sites, an introduction for staff and volunteers. The overall goal of this video is to provide a context and overview of alternate care sites for those that may contribute to the development and/or operation of one. Specifically, by the end of this video, learners will be able to describe an alternate care site and its purpose in the COVID-19 pandemic, describe basic or austere medical care provided in an alternate care site and the rationale for this level of care, identify types of roles and workers needed to staff an alternate care site. As the COVID-19 pandemic unfolds, plans are underway across the country to identify new ways to care for the thousands of patients who will become ill. This brief video is intended to introduce volunteers and healthcare staff to one response strategy called alternate care sites. The overarching goal of an alternate care site is to deliver basic or austere inpatient care to adults in a safe and caring non-hospital environment. This approach provides the maximum good for the greatest number of people. Austere inpatient care is required when the resources of space, staff, and supplies are constrained, as in the case of this pandemic. When hospitals in a region are no longer able to accept all patients needing care, public health agencies, governmental agencies, and hospitals work together to set up and activate an alternate care site. How the care site will look and function in your area will be dependent on the specific needs and the available resources of your jurisdiction. In addition, the name and term used for the care site will be determined at the local level. For simplicity, alternate care site is the single term used throughout this video. Decisions regarding the health conditions appropriate for treatment at the site are made prior to opening an alternate care site, and it will be clearly defined and communicated. For example, some sites may only admit adults with COVID-19, while other sites may be designed for patients who are not infected with the virus. The goal of this video is to clarify the important function of an alternate care site and demonstrate the need for staff and volunteers from both healthcare and non-healthcare backgrounds. It is our hope that you will begin to picture yourself contributing to this response effort. This image shows patient care units assembled by New York Army National Guard members and civilian staff at the Jacob Javits Convention Center in New York City, March 27, 2020. The convention center will be an alternate care site to ease the bed shortage of New York hospitals as part of the state response to the COVID-19 outbreak. Within geographic regions around the country, hospitals are working together to meet the increasing demands of this pandemic. Hospitals will need to share resources, including staff and materials. Patients may need to transfer from one hospital to another to promote patient care and make the best use of available resources. Right now, hospitals are doing all they can to convert quickly from their current care capacity to surge capacity. That is, the maximum patient load a hospital can handle. Hospital response plans involve placing beds in spaces not generally designed for patient care, such as meeting rooms or classrooms, as well as increasing the number of patient beds per hospital room. Another strategy to increase bed availability is to postpone or cancel elective admissions and elective procedures. This ability to make more beds available is termed hospital surge capacity. Once hospitals in a geographic area have exhausted their collective surge capacity, additional facility space beyond hospital walls is needed. This expansion site for the delivery of austere medical care in a non-hospital setting is often called an alternate care site. Treating patients who are less critically ill and in need of fewer medical services at an alternate care site allows hospitals to continue to care for the most critically ill patients during this pandemic. When people become ill, they will first seek care at a clinic, urgent care center, or a hospital emergency department. The severity of their illness will determine where they will receive treatment. Those who are gravely ill will be admitted to a hospital. Those needing basic medical care and not able to return home could be referred to an alternate care site. Those whose illnesses can be managed at home will return home with treatment recommendations. An alternate care site is not intended to serve as an emergency department, clinic, or an urgent care center. Patients should not present to an alternate care site without a referral. This approach helps assure that only those patients meeting admission criteria and needing basic or austere care are admitted to an alternate care site. The process for referring patients to an alternate care site will be determined by each jurisdiction. To aid patient survival, an alternate care site should maximize the use of limited resources by limiting the types of medical services provided and adjusting the level of care to provide the maximum good for the greatest number of people. This is best accomplished by providing basic medical care and reserving the delivery of critical or intensive level care to existing hospitals. Planners have used the term austere care to distinguish the basic inpatient care from the complete complement of services and treatments available to patients in a fully equipped hospital. The types of inpatient medical services provided at an alternate care site may include the following basic cares: medical care, nursing care, intravenous fluids, intravenous and oral antibiotic treatment, respiratory support, including oxygen. In order to keep care austere or streamlined, there are a number of patients who should not be admitted to an alternate care site due to their need for intensive or specialized hospital care. For example, patients needing any of the following types of hospital services or treatments would not be admitted: mechanical ventilation, cardiac monitoring, vasopressor medications, advanced cardiac life support, complex diagnostic testing, radiology or laboratory tests, blood transfusions, hemodialysis, and labor and delivery care. While an alternate care site cannot and should not provide the full complement of medical services found in a hospital, patients can expect to receive care in an organized and thoughtful manner. Upon admission, all patients will receive an identity band from the admissions clerk. A patient tracking log will be kept current by the clerk or unit secretary. All patients will receive an admission assessment, and a care plan will be developed on-site by healthcare personnel. Standard admission orders will be used for all patients and initiated upon patient arrival. Patients will receive a nursing assessment at least every 12 hours, including vital signs. Due to high patient volume and limited staffing, patient charting will be minimal. However, all providers will use multidisciplinary progress notes to document significant patient events, changes in patient condition, and changes of the plan of care. Once admitted to the alternate care site, a patient may be transferred to a hospital if their condition worsens and/or if the hospital beds become available. The types of licensed and certified healthcare professionals needed to provide patient care include physicians, physician assistants, nurses, nurse practitioners, nursing assistants, EMTs, paramedics, pharmacists, and respiratory therapists. The staffing plans will be based on patient care needs and the availability of licensed and certified healthcare professionals. Healthcare employees from hospitals and clinics, such as healthcare volunteers affiliated with a volunteer organization, will be needed. In highly impacted areas, healthcare providers from within the military may also be deployed to provide care. In addition to basic medical care, wherever possible, an alternate care site may provide chaplains, social workers, behavioral health professionals, and interpreters to support patients and their families and staff. Multiple workers are also needed to provide supplies and logistical support for patient care. These individuals will provide services including logistics and coordination, administrative support, housekeeping, maintenance, food services, and supplies and distribution. Individuals in these roles do not need prior experience working in healthcare settings. Everyone working together will create a safe, organized, and clean environment for patient care. Many hospitals have compacts or agreements in place to share staff and resources at an alternate care site. It is predicted that there will not be enough of these personnel to meet all the staffing requirements. Volunteers are needed. Every state is required to have a system for registering volunteer health professionals who want to help in an emergency. The federal program is called the Emergency System for Advanced Registration for Volunteer Health Professionals, also known as ESAR-VIP. The name and format for participation vary from state to state. In many states, the Medical Reserve Corps is a program within ESAR-VIP. Remember that individuals with many different skills are needed, and it is not necessary to be a healthcare provider in order to be helpful during an alternate care site activation. If you have interest in volunteering at an alternate care site, please register with a volunteer organization serving your local area. Pre-registered and pre-credentialed volunteers can then be deployed when needed. Unaffiliated spontaneous volunteers will not be accepted at an alternate care site. It is hoped that volunteers will step up to help from organizations such as the Medical Reserve Corps, community emergency response teams, and other local community volunteer groups. If possible, an alternate care site is activated in a building that is close to one or more supporting hospitals. Proximity of location simplifies the transfer of patients and the sharing of resources. Additional requirements of the building include, but are not limited to, safety and security. Can the building be locked down? Is there controlled access? Is the building environment safe for patients and workers? Communication capabilities. Can multiple phone lines and internet connections quickly be activated at the site? Parking and loading. Is there an area where patients can be easily transferred from ambulances into the building? Is there ample parking for workers? Food and supply preparation. Is there an area where food can be prepared safely or received from a catering service? Electrical supply. Does the building have a system of backup power? Restrooms and showers. Are there sufficient numbers of restrooms close to the patient care areas? Waste management. Is there adequate space to safely store contaminated waste until pickup? Building size. Is there sufficient square footage to provide space for patient beds as well as work areas for healthcare providers and support staff? Is there space to store supplies? In addition to planning space for patient care, several additional operational units also need space. These areas include Medical Command Center, Admissions and Registration, Communications, Patient Support Services, Pharmacy, Food Service, Loading and Receiving, Supply Management, and Temporary Morgue. The original idea for an alternate care site was to care for patients in an open layout floor plan, allowing healthcare personnel to easily monitor a large number of patients. The open layout floor plan concept is still in use, with other layout plans also considered. The floor plan for an alternate care site is determined by patient care requirements, staff needs for efficient and safe working conditions, as well as the physical characteristics or limitations of the identified building. This is an example of an open layout floor plan arranged as a 50-bed pod or nursing unit. Using this 50-pod model, an alternate care site can be expanded as needed to fit the needs of increasing numbers of patients in increments of 50-bed pods. As the layout grows, additional staff would be needed to provide patient care as well as promote the overall coordination between and among pods. Examples and locations that could be suitable for use with an open layout floor plan include convention centers, National Guard armories, school gymnasiums, hotel conference rooms, community centers, and large tents. A private, semi-private room plan may also be used. As patients are recovering and need less assistance with activities of daily living, sites such as hotels or long-term care facilities can be desirable locations to provide care due to the option of private or semi-private rooms with bathrooms and a quieter environment. Using this plan is dependent not only on the availability of the building, but also adequate staff levels to provide care. Examples of buildings that could be suitable for the private semi-private room plan include empty hotels, closed long-term care facilities, college dormitories, camp dormitories, and retreat centers. At an alternate care site, the Incident Command System provides structure for the overall direction and coordination of the site, including ensuring worker safety, ensuring site security, providing overall management of the site, coordinating activities with external agencies, and working with the media. Under the Incident Command System, everyone follows the chain of command, which helps avoid confusion and promotes an organized working environment in a situation where many people may be working together for the first time. Each worker on site has a specific and limited job function, and each worker reports to only one designated supervisor. Upon arrival at the site, all workers receive an orientation called just-in-time training. The training is essential to familiarize workers with the site and to clarify responsibilities. It will include, but not be limited to, standard operating procedures for the alternate care site, a situation report with a review of the current situation on site, a review of clinical updates and treatment modalities, specific role and duties of staff and volunteers, responsibilities for protecting patient confidentiality, standard reporting and communication procedures, infection prevention instruction consistent with the CDC guidelines, including training or reviewing standard precautions and the use of personal protective equipment when needed. In this unprecedented time, alternate care sites can be an important local resource to provide the maximum good for the greatest number of people who are ill and needing care. A diverse workforce with varied skills is needed. It is our hope that you can picture yourself contributing to the success of your local alternate care site. If you are a healthcare employee of a hospital, clinic, or other care site, contact your administrator to inform them of your willingness to work at an alternate care site. If you are not affiliated with a healthcare entity or public health agency, contact a volunteer organization in your area to become pre-registered. Volunteer organizations like the Medical Reserve Corps, Community Emergency Response Teams, the American Red Cross, and others will be called upon to support this important response effort. Your help will be needed and appreciated by your community. Thank you for your service. If you want a certificate of attendance or CEUs, please register for this course at z.umn.edu/alternate care sites. For more information about the University of Minnesota School of Public Health and Health Emergency Response Office, see the following websites: sph.umn.edu, healthemergencyresponse.umn.edu. Produced by the Health Emergency Response Office and the School of Public Health, University of Minnesota. This video was adapted from a previously developed training module.